As we commemorate Armistice Day here at Fort McHenry, let's look back at the work of the 300 nurses who served at General Hospital No. 2. Now, established in 1917, General Hospital No. 2 comprised 100 buildings and had the capacity to serve over 3,000 patients at any given time. That's a lot of work. When we think about 3,000 patients and each of their daily cares and needs, each glass of water brought to them, each bed that needed changing, every single moment of their lives, the nurses are the ones who attend to each of those needs. And there's sweat in every moment of their day to looking after those 3,000 patients. Now, many, many years after their service, many of those women, including Emily Rain Williams, who was the chief nurse at Fort McHenry for a time, looked back on that time and they saw that she described their work as, it was our task to rebuild out of the wreckage of war clean, whole, and useful men, fit to essentially carry on the democracy they'd been fighting for. And when she considered that work, when we think about what a nurse does, they are seeing not only to the body, but the mind and the spirit of their patients to make sure that they can carry on after they've completed their service and returned to civilian life. So if we think about the First World War and the types of injuries nurses would be working with, consider machine gun use and machine guns firing over trenches. So you have many men who return with damaged faces that need to be reconstructed, actually rebuilt. For many men who suffer from shell shock during this period, with seemingly endless bombardments, the men who suffered shell shock had to come back and find their way back to a normal life. And the nurses would help to attend to that by finding them simple things to do, ways that they could decompress and reconnect to the world around them. For those men who suffered gas blindness from gases used overseas, some of them would regain their sight. But for many of them, the nurses here at Fort McHenry and at Evergreen over at Johns Hopkins University, they would have to help those men learn how to essentially build a new life. For the occupational therapy and the physical therapy departments, those women would help these men regain their gross and motor skills so that they could actually return to their work. At the vocational school, these returning soldiers would learn a new trade if necessary. And when we look at 1918, of course, there's an additional challenge that affects not only General Hospital No. 2, but the community around it and the world at large. And that's the influenza epidemic that begins here in September of 1918. On September 17th, a few patients from Camp Holabird nearby arrived with intractable influenza. Their symptoms were very familiar, and when these men arrived, they were treated at General Hospital No. 2. The nurses attending to them watched over the next month as 1,000 patients were diagnosed with influenza, and it spread rapidly throughout the wards. In her diary, Emily Rain Williams described this moment by saying, "The men dropped like flies." And throughout the city of Baltimore, over the course of 3 months in fall 1918, over 4,000 Baltimoreans died from the influenza epidemic. So as we consider the types of precautions that we're taking today, these were the same sorts of things that nurses were taking then. The masks that they wore to prevent the spread of disease, the avoidance of crowds, many of these things to avoid risk, they were using back in 1918, recognizing the challenge that faced them. Not just them as nurses, but the community around them. And so confronting that epidemic took a great deal of bravery, which of course you find here at Fort McHenry and always have. But when we think about the nurses and their lives here, consider the amount of compassion that's required to bring a simple sip of water or juice to each patient. 3,000 men in need of your care throughout the day, 3,000 pillowcases to change, 3,000 meals to provide, 3,000 letters to write home. If you think about all of those simple things, just talking to someone while they're recovering in a bed, trying to help remind them of the trade that they used to do. When you think about the simple moments of hospital life, the nurses are always there by the bedside to attend to each patient. They are the first responders. When a patient needs something, the first thing they'll say is, "Nurse, I need help." and those women were there for them. All 300 of those women worked overtime and time again to look after not only the patients, but also during the influenza epidemic, to look after each other, because the staff was just as affected as the patients. So when we look back at this time, and we consider what kinds of qualities it took to be a nurse at General Hospital Number 2, or in fact, to be a nurse at any hospital anywhere in the world today, it took compassion and it took commitment. And for them and their vocation, we can think about, while the buildings are no longer here at Fort McHenry, the stories continue. And those characteristics of compassion, that commitment to duty, that commitment to serving others, if we look around the hospitals today, we can see that same bravery and that same compassion.
Every son of liberty, hurry right away, no delay, go today.